See, the repair costs much less than for what we are doing now. When we replace, we have been using valve which cost anywhere from 30,000 to 1 lakh. Now with the repairs, you don't have to do that. We can use some rings which cost less. Sometimes we use a material which costs only about 5,000 rupees. With this, the cost of surgery comes down, first thing. And second, the maintenance cost goes up to the patient. Normally for maintenance, every month, approximately 600 to 1,000 rupees need to be spent by the patient for blood tests to monitor the blood thinner dosage as well as the drugs. Now with the repairs, these people don't have to do it. After 3 months, they stop the medications. They don't have to go to the doctor. They can go to the doctor every 6 months or 1 year to see how things are going. That is because, see, this is following an infective process. The commonest is sore throat. After that, they develop. Now, sore throat affects generally younger people, especially when they are in overcrowded areas. They go to the schools. One boy gets affected, the whole school gets affected. So the younger people have got less resistance. They stay in more overcrowded areas, including schools, friends, all that. So they develop this sore throat. Once they develop this sore throat, some of these people, after about 5 to 10 years, they develop this problem. Oh, see, their life gets shortened. In about, once they get affected days, within about 10 years, the heart becomes very big and they cannot walk, they cannot do any work, and they die prematurely, cutting short the life of these young people. We see the precautions for these are, see, there are two levels of precaution. One is primary prevention, that is before it gets affected. See, that is not too much in our hands. We have to avoid overcrowding. And then second thing is when the people develop sore throat, especially in children, go to the doctor for early diagnosis and treatment. And the secondary prevention, we call, with increasing economy, the incidence of rheumatic fever is coming down in our country, definitely compared to before. The secondary level is more important. Once we know some person has got the joint pains and sore throat, they need to be put on injection of penicillin. We call long-acting penicillin. Once in 3 weeks, we give that injection till the age of 40 years. That has been shown to cut down the rheumatic heart valve problem drastically. So once we make a diagnosis of rheumatic fever, they need to be put in an injection of Penidu or one of these long-acting preparations till the age of 40 years. Once in 3 weeks, they need to take the injection, and that has cut down the recurrence of this fever and heart.